Oh, the second. I'll be there in a moment. Everybody can see it?
Yes.
Okay. Okay, again, welcome. And our topic today is outdoor asthma triggers and air quality. Our objectives today is just to identify the most common outdoor triggers, describe what is the September asthma peak week, what is thunderstorm asthma, what is the air quality index, our flag air quality program, well, not ours, it's the EPA, but also wildfires and the effects of asthma and the air pollution effects. And since we are still dealing with the harmful algae toxins, the red tide and the blue-green, so we're gonna expand on those too. So living in Florida and everywhere else, we're surrounded by nature and plants and pollen and all that good stuff. I'm here in Florida, so we know that we don't have the determined seasons. We just kind of go through it, and we have some temperature changes and some the leaves will fall, but eventually in early pollen season, I mean, starting the first couple of weeks of January, when the rest of the nation, it's covered probably in snow. We are covered in yellow pollen. So one of the first ones that we are going to cover is actually the ragweed pollen. The ragweed, it's like right now we are in season. So if you can see, producing a fine powder pollen from August into November with peak levels in mid-September. We already, reached that peak, but we here in Florida, we still having those effects. It is very light and it's really easy to flow in the wind. And in fact, it has been found that in the ocean, as far as 400 miles away from the coast and 2 miles up in the air. So yeah, it can travel really fast. So some things that you can do is just time your time outside, and especially in the afternoons and evenings when possible. Cover your hair, cover yourself if you with some things that you can actually take off before you enter your home or your office. If you do for a morning stroll, outside your workplace. So you can, take it off and not bring it inside. Right now wearing a mask is very common because of the pandemic. Yeah, if you can wear a mask and sunglasses, that might reduce the pollen effects. You can also talk to your primary care provider, your allergist, and see if they can prescribe antihistamines or other allergy medications. As pollen season brings you first, it can also affect your asthma and trigger your asthma. The next one is the tree pollen. So we, oops, sorry. So spring allergy seasons is caused by tree pollen. And like I said before, in southern United States, pollen season starts as early as January, and we know that. And some of the symptoms, I don't have to tell you because you probably experienced them yourself: runny nose, sneezing, itchy nose, ears and mouth, stuffy nose, red and watery eyes, and swelling around the eyes. Some of the trees, there's so many trees out there that can actually produce pollen that they're can affect your allergies and trigger your asthma. Is you see them in the alder, ash, aspen, beech, birch, box elder, cedar, cottonwood, hickory, mulberry, oak. Depends on where you are in the South, pecan or pecan, willow. That's reminds me of my Southern husband that he says, yeah, it's pecan. He's from Georgia. So thankfully, there are several options for relieving the pollen allergy symptoms. Again, you can take over-the-counter medications, but also you can consult with your physician or your allergist about symptoms and treatment. There's certain medications that can help, like antihistamines, decongestants, leukotriene modifiers, and chromolysodium nose sprays. If so, you can, depending on your physician, you can use this short term or long term, depending on your allergies and your reaction to it. So if you can prevent these allergies so they don't trigger your asthma, that's the best thing you can do. So grass pollen. Grass pollen, it's again a fine powder-like substance. It consists of microspores produced by the male parts of the grass, and this pollen travels in the wind to fertilize the female parts of the grass. Grass pollens, like ragweed pollen, it's very lightweight and easily spreads. So this makes it much easier to breathe in and trigger your allergy and asthma symptoms. Grass allergy season is when the grass is pollinating, and in the southern areas of the country, some grasses may cause year-round allergies. Again, here in Florida, the grass it just kind of stops growing a little bit during the winter time, but it still grows. Also, if you didn't know, there's a grass allergy from certain fruit and vegetables that they're botanically related to grass. And these are peaches, melons that include watermelons, cantaloupes, and honeydew, celery, orange, tomato, and white potato. So you might have an allergy. It was like, I have not been outside, but you've been eating peaches or melons or all these fruits and vegetables, and that might be the cause of you having allergies. And again, so basically to avoid pollen allergies, it's just when you go outside, protect yourself, wear something to cover yourself, take your shoes off before you enter your house, or if you can at work, I don't know, but home. And if you do like an afternoon stroll before you go to bed, take a shower, so wash your hair so that pollen gets out. And also when you take your pets outside, they're like sponges that or fluffers. They can pick up everything. So you need to you should dust or clean off your cat or your pet, your dog, that when they go outside, because they will bring pollen with them in their fur. So sometimes we don't think about that, but they can bring they can bring all kind of stuff inside too. So not only us. So mold. In the previous webinar, we talk about indoor mold, and obviously outdoor mold, it's always present. Molds are microscopic fungi that produce spores with that it grows, again, both indoors and outdoors. Humid weather and high concentrations during the summer is one of the areas. And unlike pollen, you can't see it piling up on your car, on your windshield, and you will not notice these spores floating in the air. But you can limit your exposure again, wearing a mask. If you're going to be outdoors, when you return indoors, take a shower, wash your hair, change clothes. And so outside, when you guys and the other rest of the nation, I mean, we do have falls and leaves, and I have been raking leaves started already. But when you accumulate them and you just leave them in a pile, know that this is a perfect opportunity for the mold to grow. So when you're raking and piling in bags and or recycling for yard waste. This is an exposure that you should be avoiding to avoid. So you can have somebody else do it, or you just protect yourself with masks and goggles if you can. And when traveling by car, please keep your windows closed because you're going to be breathing this. So some of the outdoor mold types are Alternaria, which mainly found outside in plant soil, and it's airborne that settles on flat surfaces. It is not that moisture dependent, but it thrives in moist areas too. Alternaria present with long hairs and a velvety texture. It ranges from colors to dark olive to brown. So I'm pretty sure you've seen it. The other one is the Aspergillus, one of the most common molds, and it is also allergenic. This is a fast growing mold, and it actually builds up on building material, fallen leaves, and compost pile. So again, if you have a compost pile outside, you know that mold grows in there. The other, this mold can go from blue-green to pinkish red. Another mold is the Cladosporium, which loves any damp, dark environment. It is a black or green pepper-looking mold that often grows on the back of toilets or painted surfaces. And this mold produces allergy symptoms such as red and watery eyes in humans. And that's airborne, like almost every mold, and it's hard to eliminate completely. So it's one of the hardest one. And then the penicillium one that it's the most often found on wet and dead organic matter outside. You might see it as fuzzy green, white, or blue fuzz on spoiled fallen fruit. I have a grapefruit tree in my backyard, and when they fall, that's what I see. So its spores can cause allergic reactions and other irritating symptoms. Okay, so very important, your car cabin filter. So change your filter as recommended by your vehicle manufacturer's instruction, and it's possible replace it with a HEPA filter, because obviously when you're traveling through whatever you travel, those spores and pollen can obviously come inside your car, and basically you're breathing this air. So okay, so just make sure you do that. September is a difficult time for those with asthma. So I know it was last month, but it's usually the third week of September is considered the asthma peak week. The ragweed is the most common fall pollen that allergy peaks in September, and the mold counts goes up as leaves collect outside. We have the children returning at school, and which are exposed to respiratory illness, and then the flu season starts. And currently, we still have the coronavirus, and definitely this can flare up the asthma in September. So it's just a lot of combinations and factors that make September an awareness month for if you have asthma and have allergies too. Thunderstorm asthma. So any time that you have a thunderstorm and it's pollen season, so rainfall is usually known to remove pollen from the air, and sometimes we really like for a nice shower to get this pollen out of our cars and every surfaces outside. But if it's accompanied with a thunderstorm, this might increase the concentrations of pollen. So thunderstorms pull pollen grains up toward the moisture-rich clouds where they rupture, and then the pollen fragments or pieces of pollen grains are brought back to the ground by downdraft where the airflow spreads them. This can create a very high levels of airborne pollen allergen exposure, possibly triggering an asthma attack. So, it's nice. I love when there's this thunderstorm and it's coming, and you see, you know, the wind ruffling all the leaves and all the stuff, but it's good to see it from inside and not being outside if you're trying to avoid that. And so from here, I'm going to leave Bruce so he can talk to you about air quality monitoring and wildfires.
Daniela.
Join the meeting.
Thank you, Wanda. So I wanted to talk a little bit. One, I was really happy to hear that this came off during Respiratory Care Week. And so all the people that are on the call that are respiratory therapists, you know, looking at all that you do and supporting everything you do, I think most medical hospitals and clinics understand now how important respiratory therapists are and the job that they do to support healthcare. So what I want to talk about briefly is the things that you can do to avoid. I think the question on outdoor allergies is what can you avoid so that you don't run into trouble? And we know that right now wildfires are a big issue, and that smoke can travel, you know, across the country. So not only those that are, you know, in California or Idaho exposed to some of the fires, but some of that particulate is also picked up and deposited in the air that we breathe as well. There is a site that you can use to check the quality of your air. It's called Air Now. It's provided by the EPA, and they have specific websites so you can see if there's a sampling area in your area, you can check exactly what your air quality is. And yeah, obviously, let's see, I don't know if the video will run. We can try it. We tried it before, it didn't run. Did it go anywhere?
Just let's try. I think I did it correctly. Let's see. Let us know if you can't hear it.
There we go.
Smoke Ready means knowing where to get air quality info. This video will demo some of EPA's tools. We'll start with the Air Now dial. Enter your location to see a dial with your current air quality, today's forecast air quality, and tomorrow's forecast air quality. Scroll down for an extended forecast. The fire and smoke map will give you more information. Here we display data from permanent government monitors, temporary smoke monitors, and low-cost sensors. You can also enter your location to see if there's a smoke outlook for your area. Click on monitors near you to see tools. The colors correspond to KPIs.
Oh, we're losing sound. I don't hear anything yet. I don't hear anything
Some
now.
people use non-government sites for real-time sensor data. Be aware that sensors can under or overestimate pollution. EPA scientists developed a correlation pattern. Sensors can be more accurate information.
Okay. We'll go to the next slide. Yeah. So, you know, I think being able to identify where the problems are if you're traveling, or, you know, fortunately we have not had wildfires lately, but to understand what the pollution levels are as far as the particulate matter, as well as what's going on with the wildfires and how the smoke is affecting our pollution. So you have an understanding of where we are. And these colors represent the air quality. So you can, you know, look up on the map, and you can use the EPA map on air quality and determine what's going on in your area. Next slide. So it also gives you, so forecasts, so you can look at, so particulate matter. So when we get down to particulate matter, obviously the larger particles we can see somewhat in the air, but when we get into what's called fine particulate matter, which is less than 2.5, that's the stuff that's really small. It's going to get deep into your lungs. And so having that listed, as well as ozone, and I think some of the sites do list also sulfur dioxide as well. So those are both airway irritants that we want to avoid or keep levels as low as possible. And I put Altamont Springs, which is where I live, so you can see there is a monitoring station that tells me what's going on in Altamont Springs. So far my air is good today. So, next slide. Also, there's the ALA has, and Asthma Allergy Network also has ways of looking at predictions of asthma, allergy, and flu that take case reports and put it together so you can have predictions of what's going on. So if you're going to plan a big event outside or do something and you're concerned, you want to avoid some of these things and pick a day that's maybe safer, you can get these numbers basically from the forecast. So that's another way to forecast what's going on outside and make accurate decisions. Next slide. So interesting enough, if you haven't seen this, ALA is a great resource, American Lung Association, but the ALA also looks at air quality in your state. And I think in the long run, we have to start looking at what can we do to improve the air quality in where we live. Whether it's addressing car pollution, it is addressing and I was going to talk briefly about it, but in some states they still have coal-fired power plants, and that puts sulfur dioxide and particulate in the air, and that has been shown to have a definite effect on ER visits and hospitalizations in asthma. So starting to look at where you live, and obviously if you're looking at moving somewhere and you have asthma, maybe you need to check out what that state's air quality is. Next slide. So when we look at pollution, it's important to look at the size of the particulate. So you can see this is from an EPA site, but the size of a human hair, the size of beach sand, and now we're getting into much smaller.
It should be interesting to see, but I guess anything's better than.
So when we PM 2.5 is probably the they call it fine particulate air. And the concern with that size, particle size, and when the EPA does limit some of the particulate matter as far as safety, when we start getting really small but fine particulate matter, we start to get particulate that can actually lodge in the lung and may even travel inside your bloodstream and affect your brain. So the question is, can pollution have an effect on genetic disorders, on other respiratory disorders? And we are inhaling particles that are going way deep in our lungs. Next slide. So, what do we do about fires? Obviously, we don't want to be in the area where the fires are. Wanda talked about is changing your cabin filter in your car if you're driving through. Most of the cabin filters are behind your glove box, and if you can always Google or YouTube the video and see they're not that difficult to replace. But and also consider, if you are going to be out, is you want these are particles that you want to scrub from the air. So either a K95 or N95 mask to help decrease the amount of particulate that you're going to inhale. If the fires are severe, you may want to decide to stay indoors. I was up in Yellowstone and again in the Sawtooth Mountains in Idaho, and we had a couple of days where the wildfires were causing a lot of particulate in the air. Now, make sure you have your inhaler, that would help. But also, you may change your plans based on what the level of smoke is in the air and the particulates in the air. Next slide. So I think Wanda grabbed this slide. I saw this too recently. If you look at the map on the United States on the left-hand side of your screen, you think that, well, we don't have any wildfires in our area, but you can see how the smoke travels in the upper levels of the air and how it affects more of the United States than just in that area. So we all have to keep kind of a close eye on it. And then the bigger question is this climate change? Why are we having so many wildfires? Why is, this is affecting our air quality overall as well. Next slide. So air pollution in the United States. So, we can see air pollution in some cases. These are sometimes, this is smoke, particulate gas, and it worsens people's symptoms. There's been some studies looking at particulate matter and sulfur dioxide and nitrogen dioxide and use of rescue inhalers. So there's a device that can be put on an inhaler that will indicate, specifically rescue inhalers, that indicates when the inhaler was used and where where it was, and then you can combine that with other data to see, what the level of pollution was and what the particulate levels are. And so we're starting to, put together the data that we can link the changes in the quality of air to the increased use of asthma visits, increased use of rescue inhalers, and increased cost of healthcare. And that may be a future perspective that we need to look at as far as how is our air quality affecting our cost of healthcare as well, and asthma health. Next slide. So does this affect people getting asthma? Obviously, we know that air pollution can have substances that cause wheezing, coughing, and may play a role in the development of asthma in children. If you think about the cause of how pollution affects human beings, in Beijing they had some required programs to decrease the level of pollution because of the Olympics. And when they did that, right, they dramatically decreased the level of pollution. They also decreased the level of early births. So the question would be, it's a casual relationship, but does pollution play a role in premature births? And then again, does pollution play a role in the development of asthma? Because we have incidence of asthma is greater than it's ever been. So what is generating this cause? So that may be one of the things we need to look at. Next slide. So this is an important issue, I think, that came up with COVID and looking at socioeconomic determinants of health. And then we see, we've had greater population of African Americans with COVID, and yet they're overall the population is smaller, but they have greater incidence. So some of it is where they live and the redlining effect. If we look back, a long time ago, how we formulated low-cost loans in certain areas, and then where power plants, where certain chemical plants are put, green spaces, trees, all of those things may play a role in some of the disparities of healthcare. And we know with asthma, there's a much higher incidence in people from Puerto Rico. There's a higher incidence of African Americans, Latinos as well. So, how does this environment play a role in the incidence of asthma, as well as the access to healthcare? What role does the access of healthcare play? And we now see that access of healthcare has played a dramatic role in the development of COVID as well. Next slide.
Hi, Bruce. I'm going to add something also.
Oh, okay, sure.
It's just, and you mentioned it before, but Hispanics and Asians, but especially also the African Americans, had a higher risk of premature death from particle pollution than whites did. Hispanics and Latino communities have been even more deeply affected by COVID-19 than African Americans. People of colors also may more likely to live in counties with higher levels of pollution. Non-Hispanic Blacks and Hispanics were more likely to live in counties that had worse problems with particle pollution. So life expectancy in the US decreased by 1 year in 2020 due to the COVID-19 death for African Americans. The decrease in life expectancy was 2 years. And for Hispanic Americans, the decrease was 3 years. So yes, definitely COVID-19 has impacted our health, and also our respiratory health. And so it just makes us definitely look into our environment, because, you know, if you live in a healthier environment, obviously, you're going to experience healthier outcomes, even when you have a chronic condition like asthma or any respiratory or heart condition. So we just need to look into these variables in here and see how can we help our communities of color to have better outcomes when exposed, or just diminishing the exposure to air pollution in where they live. So I'm going to the next slide, and I think I'm going to talk about this one. So
yeah.
Yes. So if you're here in Florida, and if you want to participate in the air quality flag program from the EPA, please let us know. Write to an email to floridaasthmacoalition@gmail.com. And so we'll send you a free flag kit that includes these 5 colored flags. So you can, that matches the air quality on that specific day that you're looking. So these flags, you can use them at schools or any community organization that would like to help their community and be aware of the air quality in their area. So obviously we're going to have a green, a yellow, an orange, a red, and a purple flags sent to you. So please let us know if you're interested, if you're here in Florida.
Oh, so yeah, algae. I was going to mention so we're now looking at, why do we continue, what are we using for power, energy, what are we doing for the future of the planet itself? And I think there's some extrapolation that if we were to remove the coal-fired power plants and have alternative power solutions, that the amount of money saved, and I'm trying to find it, I think, is significant enough to supplement the cost, that we should be able to find alternative sources of energy, because we are, affecting our planet in the long term. We're going to talk a little bit about algae, because anyone who's traveled to the coast of East Coast or mainly the West Coast this year of Florida has encountered algae, red tide, and blue-green algae toxins. So the effect of those are in the respiratory system is significant. Next slide. So, and anyone who's actually, been inhaling anything from these toxins, shortness of breath, eye irritation, cough, you use your rescue inhaler, and 10 minutes later, you feel like you never used it. It's just very, very irritating. So you really have to avoid these blooms if you can. And these blooms may last a few days to weeks. And I think in St.
Join the
Pete
meeting.
Beach, they closed the beaches for, I believe, 3 to 4 weeks because of the level of algae toxins. Next slide. So, I remember this. So, currents and where the red tides are, when you're planning your trip, you have to be aware of it. It doesn't take, as soon as you walk out on the beach area, you will feel the effects. So this is another way that you can double check where the red tides are and determine, where you're going to be, where your vacation is. If you're planning something outside and you're near the coast in these areas, maybe you need to change your plans to help decrease the effects of these toxins in your lungs. This is toxic. So you don't want to be swallowing, swimming, boating, creating aerosols. If you go out and you go out water skiing or with a jet ski, you're forming these aerosol droplets that are you're gonna inhale. They're gonna be on your skin, in your ears. So you're gonna get runny nose, coughing, wheezing, throat irritation. This is the toxic effects of the bloom are dramatic on the respiratory system. Next slide. So I had the pleasure of walking along St. Pete Beach during the summer, and there was a algae bloom a couple of days prior, and the day that I went out on the beach, there's hundreds of dead fish. So the fish are just can't survive in that toxic level. So we're polluting our oceans. Our oceans are being polluted by runoff of fertilizer and other pollutants. So we can visibly see the effects of pollution. Next slide. So what happens to this? What happens to the fish after he dies and he's on the beach? The fish, a bird comes and eats the fish, and then we send the toxins into into another part of the environment. Usually it's posted. Obviously, here's our bird eating the fish, and avian pollution is now continued. So when you see it, I think it was Indian River Lagoon had a dramatic toxic bloom. I think in that case, it was thousands of fish that were dead on the shore. Next slide. So it's very dramatic.
I just wanted to also to let people know that these toxins are neurotoxins, so they will affect the nervous systems of the animal that ingested. So that's the reason the fish and any marine life is affected. So it's not only fish, but the dolphins, the manatees, turtles, tortoises, whatever enters the water definitely affects in the birds, affects these creatures. So even one of the expressions in here of the birds, if you see them like they're wobbly and drunk, it's because the toxins are affecting their neurosystem.
And affecting ours too. So I wanted, this is one slide I want to bring up. I was thinking about bringing up in the beginning, but we break down asthma overall as extrinsic or intrinsic. So intrinsic obviously means internal, extrinsic means an internal trigger, extrinsic means there's an external trigger. So for extrinsic asthma, which is the most common, usually you'll see high levels of eosinophils in the blood, high levels of IgE. There's higher levels of IgE within the blood cells released into the bloodstream. So the end result is, these triggers for extrinsic, pollen, what we've been talking a lot about, pollen, mold, house dust mites, animal dander, some of the foods. And then in intrinsic asthma, we're looking at a different trigger. These are non-allergic triggers. So this is cold air on the airways, the effects of cold air on the airways, smoke, anxiety, viruses, and infections. So, and the other thing about intrinsic is it's more common in females than in males. But can there be crossovers? Yeah, of course they can. But in general, so people that have allergic asthma, we can identify the level of allergy, and we have now new types of medicine to treat this. So we have injections that can help to decrease the levels of IgE and eosinophils, and hopefully then help control the asthma better. These are called biologics. And there's a bunch of them out now, but it's mainly looking at the cause and effect of extrinsic asthma and treating that. And there's more and more options available. These are things that you would need to talk to obviously your allergist or your pulmonologist about as well. And then I guess we wanted to leave time for questions so that anyone had. I think one of the things that's most important is that we gave you something that you can do, that you can address, not just that you had information, but the steps you can take to minimize the effects of outdoor asthma triggers.
Yeah, so we also gave you some examples on how to monitor your air quality through the EPA airnow.gov, the Allergy and Asthma Network, the American Lung Association. So, and also, so we have in Florida Health, we have environmental health, which is the first resource that we have in here, and it can tell you every day what are the aquatic toxins and harmful algae blooms that we have. My Florida Wildlife too, they have information on red tide every day continuously. It's updated. So we, when you're looking to vacation in Florida, so you know where you're gonna go. If not, I mean, you're gonna be like in the St. Pete area of Sarasota, and you can't be outside. You can't do basically nothing because the red tide is just toxic for your health. And so definitely that's one of the areas that you can look. You can also look at the allergy and again, the Allergy and Asthma Network weather, airnow.gov. You can also visit the Asthma and Allergy Foundation of America, the allergy, this is the Quad AI, but it's the Allergy and Immunology organization. And obviously the CDC, there's information on air pollution and red tide and algae toxins, information about asthma, the EPA, and you can actually go to floridatracking.com. So you can get some data on the effects of the environmental outdoor triggers that we might experience here. You can also go to the National Allergy Bureau, and you can get the pollen report in your area. So there's lots of places that you definitely can find information about your local air quality, and even related to smoke or anything. It's like when here in Florida, we had been blessed and we haven't had wildfires in a while, but we have the Saharan dust desert that it actually comes to this area, and also with the very hot days where the ozone levels are dangerously high, and so you have to do everything possible not to go outside and get sick. So it's you can take action in there, volunteer, participate, give ideas and how to improve our air pollution situation, and yeah, get involved. Also, I have to pitch, become a member of the Florida Asthma Coalition. We are the home visiting work group, where we plan and present ideas and how to manage your asthma, by providing education. So it's free, the Florida Asthma Coalition. Just go to floridaasthmacoalition.com and join. And we also to provide some membership benefits through partners that like to help us reduce the burden of asthma in Floridians and the entire United States. So thank you. Do we have any questions, Eddie?
Yes, we have one question, and it was from Amanda. She said she has severe asthma for 2 to 3 weeks every year in July, but has not been able to pinpoint what triggers it. She uses the EPA Air Now website for her area at that time of year, and it seems okay. Do you have any tips in order to help identify what may be causing it?
So one of the, I'm going to respond this, and I'm going to let Bruce also respond, because he's the certified asthma educator. I'm just a simple respiratory therapist, but anyhow, and by the way, again, congratulations to all the respiratory therapists in our week in healthcare. So the best thing you can do is actually kind of create a diary where when you use your inhaler, just kind of check exactly, at the pinpoint at that time of the day, where you at. If you're outside, you're inside, what's around you that might trigger your asthma, so you can pinpoint it. That's one of the areas that we in the home visiting program we do. And here it just kind of makes the person aware what's the condition and just write it down. Why? Because it will help you remember. And also when you have a visit with your physician or your primary care provider, you can actually give them this kind of diary that you're creating, and they help pinpoint, what's going on. So you can address, what time of the day. Is it in the morning, really early in the morning, in the afternoon, noon? If you're outside, what are you doing? Are you cleaning? Are you vacuuming? Or are you trying to, use, some products that they're not asthma friendly? Do you have a lot of VOCs or volatile compounds, out there in the area? Your dog is around, your cat. So there's many triggers that can definitely trigger your asthma, but just be detailed on where you at and what's around you, what time of the day. Write it down, and that will probably help you pinpoint what's causing you your asthma flares. Bruce, do you have any other?
I think we talked about doing another lunch and learn next year, but as far as writing things down or tracking things, there are some great asthma apps to help monitor your asthma and help to actually give your physician feedback when you go back into the office. So you can kind of, well, I thought I had this a couple of days a week or whatever. If you're, documenting on your phone app, and you can also document your medication as well, you can get a better picture. We do see in the practice where I work, there's some patients that will actually, in their asthma action plan, will increase their medicine during that month or that quarter, knowing that there's something that's triggering them. Whether we ever find it or not is another story, but ramping up medication during that period to decrease severity is something that's commonly done. And then obviously, if you can identify a specific allergen, can that be addressed? See an allergist to address that specifically. And then we talked about too the biologics as well, to see if you're having this reaction, this extrinsic reaction, is something like a biologic a possibility to talk about with your primary care, because with your specialist, because if you're severe, you're having significant problems. And the goal of asthma is that we can keep you doing anything you want to do. We have the solutions, we have the medication, we just have to apply it and figure out what's going to work. But we want you to live a normal life, and that's our goal.
Yes, so these biologics, and I see that Andrea, my other wonderful certified asthma educator, says that you can get allergy testing, skin or blood tests if you haven't done already. All three of my kids had allergy testing and then allergy shots for 5 years, and it really helps. Yeah, that's something that can help you pinpoint about what's causing your allergies and asthma. So these biologics, today I just received a notification that one of them, and Andrea, remind me what is the biologic compound, but I don't want to say the brand name, but they're actually getting more available for children. Before it was just kind of only adults, Now they're reducing the ages to 12. And today I just got notification that one of them, it can be used for children 5 to 11 years old. And so they're, becoming more helpful. So also, if you want to learn about a little bit more about all the respiratory treatments or medications that they're there, I will advise you to go to the Allergy and Asthma Network or .org, and they have a poster of all the medications that they're there, so you can get informed. And when you have a conversation with your physician, there's a lot of medications out there that can help you achieve asthma control. And and like Bruce says, our goal is just to reduce the burden of asthma, but also so you can do everything, even though that you have asthma, that you have it under control, and you can do basically whatever you want, activities, sports, travel, without thinking that oh no, my asthma is going to hinder me. So yeah, just okay. So Andrea said dupilumab was just approved for kids age 6 and 12. I'm sorry, I reduced to 5 because I have 5 in my mind. Thank you, Andrea. So yeah, so there's another one that you can use for children who are being diagnosed with allergic asthma, and so they can do this biologic, obviously with the prescription from your allergist or pulmonologist, your lung specialist. So also, I just saw something here. Amanda, you said bleach is a common trigger for me. Yes, bleach is not an asthma friend ever. It's just not good. So if you go try to clean a mold, it's just the best way, non-toxic way. It's just use white vinegar diluted with water or baking soda. And when you're cleaning with, to eliminate mold inside your home, you basically have to wear all the protection goggles and a nice mask, even head covering and everything, because these spores are going to fly as soon as you disturb them. So you need to really, really, pay attention to that and use some of the natural products for mold removal. Ruth says you had mentioned September is that month. Is that in Florida only, or other places in the county? No, it's everywhere. However, in Florida, we don't start school in September like some of the northern states. I know that some of the northern states, they start school after the Labor Day holiday, but not us. We start sometimes mid August. But yeah, it's a national problem, like Andrea is saying. September epidemic hospitalization rates are highest towards the end of September than any other year. And it's just because, we have that perfect storm, a combination of factors, going back to school, the flu season has started, we still have the pandemic going on, the pollen is high, especially the ragweed. So yes, the fall is starting, so the temperature's changing. It just yeah, it's a perfect combination for the September epidemic. Let's see what else that we have here. Yeah, so yeah, the sharing germs, that's usually that happens, and now that almost every back to work, and the kids are going back to school, that's when it happens. But yeah, but September nationally is the one that is the asthma peak month, especially toward the end of September. And so
there's Wanda, there's two to find it, but there's a list of asthma friendly cleaning products. Do you have that list? So that people
I think we're gonna share it through the Florida Asthma Coalition webpage, where we have it's just like and I think I shared this before. It's just like a recipe of natural ingredients that you can use. We also, we just finished from the Florida Asthma Coalition as a membership benefit. We had a giveaway of asthma and allergy-friendly cleaning products with one of our partners. We will have that information also online. These are products that are being, they were developed and they have natural, non-toxic products that you can use through that. And I think eventually one of the membership advantages that you'll have is actually get discounts for these products that can help you clean without, being toxic to the environment and to your health. So stay tuned in the Florida Asthma Coalition. Yeah, Eddie saying we will send an email with the link to free product giveaway. So in this kit, a dish detergent, laundry detergent, and an all-purpose cleaner, and also 20% discount for your first order if you like this. So be aware, please, the only way that you can see this is joining the Florida Asthma Coalition, even if you're not in Florida, but you can, we welcome everybody. So thank you everyone for your participation in this webinar. Thank you for your time. And again, to all the respiratory therapists out there, happy Respiratory Care Week. Thank you, Bruce.
I think you're unmuted. Thank you, everyone.
Well, Wanda, we're going to pick up next year with new topics, right?
Yes. So next year, this is going to be the last of the fall lunch and so when Dr. Deborah Weiss comes back and from her sabbatical as the chair of the home visiting work group, we are going to present more topics, and please let us know. Also, Dr. Zan Navakaski will send a survey, and if you have any topics that you would like us to touch, please let us know, and we'll gladly visit those, and we can present these lunch and learns webinars next spring, summer. Okay, so everyone have a wonderful rest of the week and be safe.
Thank you.
Thank you, everyone.